If you wanted to find some of the world's most leading-edge clinical research facilities, you might not start your search in Seaforth, Ontario. But here's why you should. At first glance, you might just see a small town, but you'd quickly learn that this small town is by no means sleepy.
Hello everyone and greetings from Geneva. My name is Marcy McCormick-Bain and I'm coming to you today from our offices in Geneva, Switzerland. Unfortunately, I couldn't be with you in person, but I didn't want to miss the opportunity to say hi, introduce myself, and congratulate each and every one of you in your personal effort to make this launch possible. I first met Gwen Devereux in the fall of 2007 to discuss what is now known as the Gateway Rural Health Research Institute. This program stands to be the first of its kind in Canada. After meeting Dr. Claudio around the same time, I quickly realized the passion and commitment in both Gwen and Claudio would be a worthwhile investment. This grant serves not only the members in our local communities, but has the potential to change the way healthcare is delivered in rural areas across Canada.
Located in the heart of rural southwestern Ontario, a population at high risk for chronic health problems, including heart disease, diabetes, and hypertension, Gateway has used these issues as magnets to attract medical professionals to the area to conduct groundbreaking research using state-of-the-art technology.
So the data study the acronym is Diabetes and Technology for Increased Activity, and we have a total of 24 participants, all living in the Huron County region. They have a basic criteria of higher than normal blood pressure, blood glucose, cholesterol, and also overweight. That's the basic criteria. We're also looking at a self-monitoring intervention. This included BlackBerry as the primary transmission device. The other devices included a Bluetooth blood pressure monitoring cuff, as well as a blood glucose meter, a pedometer, and a heart rate monitor. So we actually bombarded people with a lot of devices and technology. The BlackBerry was really the crux of the matter here because it was the main communication and transmission device. The BlackBerry was linked with a centralized database that we as clinical administrators or research coordinators or even the doc on the team could view at any time. The BlackBerry would communicate directly with the blood glucose monitor when the readings were taken and would send the information to the database, as well as the blood pressure monitor, which was an AMD Bluetooth blood pressure cuff, which would communicate directly, meaning the measurements were sent automatically to the database.
Since its formal launch in the fall of 2008 and its partnership with the HealthKick program, the Gateway Institute has secured private investments, garnered awards at the provincial and federal level, developed partnerships with local businesses, as well as the University of Western Ontario, University of Waterloo, the Lawson Health Research Institute, and the University of Kentucky Centre for Excellence in Rural Health.
When we talk about paralleling Waterloo, I can see a number of relationships there as well. So,
in terms of our slogan that we have embraced as far as our institution is concerned, we say we are not in the community, we are of the community. And of the community for us means the large community, certainly within the jurisdiction of Ontario, but it's really worldwide as well. So can I say it's a given that we want to continue this development? I think in order to cement it, we may need to talk about such a thing as maybe some sort of a memorandum of understanding or some formalized linkage that allows us a clear path of going forward. So let's pursue that actively. I think the opportunities for research are obviously there, but granting funding, right? I think the idea of an urban area and a rural area partnering in research, particularly in the areas of healthcare, I think are great. And I think you've got something with Lawson going, but perhaps we can even expand upon that in the areas of engineering, because there's something here that links some of the diseases that we're seeing, and I don't quite know yet what the intersecting factors are. I mean, it's lifestyle, but it could be a number of other things. So, but let me just cut to the chase here. Let's get an agreement going.
Clinical research aside, the Gateway Institute is actively working to recruit doctors to the area, which is currently largely underserved. Making full use of its brand new facility, Gateway also provides advanced training to nursing students.
We basically provide funds to local healthcare facilities to encourage them to hire students for the summer. This gives local students who have gone off to school, which we often lose at graduation, gives them the chance to come back during their summers and actually get involved in healthcare. The healthcare doors have not been very wide open to students for summer employment. So with this initiative, we've been able to increase the number of students who've been able to get experiences in rural healthcare. So with this, we've had an increasing demand over the course of the last 3 years. We started out with 3 placements, and they were pharmacy. By the completion of this round of funding, there will be 50 jobs that will have been offered through this particular program. The students love it. The employers have actually realized this is a good deal. I get somebody to work on a special project, I get to influence them, and I get a potential recruit in the future. A lot of them take this on originally as being, this is just a summer job. They get so much more out of it. And we've actually had success in people being now hired as a result of their placement upon graduation.
Within its first year of operation, the Gateway Institute's success has already had a visible effect on the community, and the growth of the facility is imminent. For more information about the Gateway Institute, please visit www.gatewayresearch.ca.